and welcome to the DSW Stories of Change conference over strengthening local advocacy leadership. Welcome here in Berlin, welcome from all over the world, from Tanzania, from Kenya. After this very inspiring movie, welcome. My name is Martina and I'm going to guide you through the next 2 days. The next 2 days, especially in the first day, we will listen to experts, we will listen to stories of change, also from young people in videos, and we will hear about the programs, about their experiences. And we prepared today an input. First, we start with a panel session and experts, and with the input of experts. We will see different perspectives from different programs. After break, we will continue with session 2 and we will dive deeper into the stories of change, watching several videos from the DSW SLALE project and about the youth-led civil society organization. Very interesting stories. And this will be the input for tomorrow for the workshops we have prepared. And tomorrow we will work on identifying the challenges, perhaps even failure, and to find solutions, how to overcome them. But before I continue, I like to introduce Angela Bear next to me. Welcome, Angela, and she is Director of the Programs and Projects and Vice Executive Director of the DSW, and she likes to welcome you as well.
Angela is on the video. I'm Catherine. She's waving now.
Sorry. Yes, now. Can you hear me?
Yes, I can hear.
Okay, that's fine. Thank you. Good afternoon to everybody. Good evening in East Africa and also good morning in the States, or I don't know. But my name is Angela Barr. I'm the Vice Executive Director of DSW, and I'm really very happy to welcome you to the Story of Change conference today. So, dear partners, dear colleagues, dear SLALE partners, and dear all, there was a lot of people who were working toward this conference. And first of all, I would like to say a thank you to the whole preparation group. But also, I would like to introduce you a little bit to DSW. DSW is celebrating this year its 30th anniversary. As an international NGO, we are especially committed to support young people to make independent and informed choices over their sexual and reproductive lives with full access to sexuality education and their sexual rights, including all kinds of advocacy engagement. DSW is implementing program activities in East Africa and also developing advocacy programs for SRHR at the subnational, national, and global levels. Since 2012, DSW is committed to strengthen also our partners' advocacy capacity, especially in East Africa, but also in Francophone West Africa and Asia. Since 2017, we have piloted, with essential support of the Hewlett Foundation, the SLALE project, an in-depth capacity development approach, which focused on subgranting and mentoring of youth-led CSOs in Kenya and Tanzania to develop successful advocacy activities for sexual reproductive health and rights. I'm really happy to welcome all of you today to share with us during the upcoming 2 days the stories of good practice and also of challenging experiences, and to discuss together how we can design learning processes and capacity development approaches between North and South, between international organizations and community-based initiatives of young people in East Africa. I wish you all good vibrations and a lot of energy for the participation during this Stories of Change conference. And I thank you in advance for your interest and all your very valuable contributions. Would that help also to change our lives a little bit more and to bring us together? Thank you very much. Thank you very much, and good luck for the upcoming 2 days.
Thank you very much, Angela, for the welcome, for the introduction, and for introducing the importance of the work of the DSW. Before we start to the first session, I like to point out some ground rules we need to observe during the video conference. So first of all, we would like you to add your clear name in the Zoom so we know who is going to write us some comments or who is in the conference at all. Of course, as you all know, we like to be harassment-free, so please don't harass, be fair and argumentative. And many of you did already, please switch off the video because the data amount might be too high, and as well as the microphone, so we don't have any disturbance. You're very welcome to ask your questions in the chat or to add some comments, and if you have any difficulties technically, please write to us and Eva and Philip will help. And please do switch off also other external devices so that we can concentrate on the conference and we don't have any distractions. We will have some breaks so you can relax. Now we start, and I'm happy to hand over now. You can see her. I'm very happy to hand over to Katrin Erlingsen. She is head of Advocacy Unit in Germany, DSW, and she is going to moderate the next panel, where we get some input from the experts from different programs. And you are very welcome to ask questions in the chat function and add your comments. So the stage is yours.
Thanks a lot. I'm very, very happy to be here. Thanks for having me. And I'm very excited to moderate this panel where we will have representatives of 3 different projects that work to strengthen local advocacy capacities. And in each of these, we will hear from each of these 3 projects from 2 different perspectives, both from the implementing advocacy partner and also from the organization supporting with technical assistance. And in addition to that, we will also have a donor on our panel to get that perspective in as well. So in total, there will be 7 people, and I will be introducing them throughout the panel so that you get to know them. And I will also make sure that we are sticking to time. We are based here in Germany and we like to stick to time, so bear with me if I'm strict on that. The first project that we're going to look into is a project collaboration between PAI and Copper Rose in Zambia. And I'm very pleased that we have Alison Doody with us, who's a Senior International Advocacy Associate at PAI in Washington, DC. And Ellie works with civil society organizations in Africa and Asia to strengthen organizational and advocacy capacity, to improve policy and funding for SRHR, and to achieve sustainable change. And Alison is joined by Dr. Natasha Kauma, who's the Chief Executive Director of Copper Rose in Zambia, which is Zambia's largest youth-led organization. And Dr. Natasha Kauma is an award-winning reproductive health champion, medical doctor, and I knew that I was going to stumble over that word, epidemiologist. But I already see Alison on the screen. It's great to see you, Alison. It's been a while. The floor is yours to talk for 5 minutes about your capacity development approach. Please, go ahead.
Great, thanks, Katrin. I'll try to stick right on my 5 minutes to keep us starting on time today. So good afternoon, good morning, good evening, everyone. My name is Allie Doody. I'm a Senior International Advocacy Associate at PAI, which is a sexual and reproductive health and rights research and advocacy organization based in Washington, DC. And so, as Katrin said, I'm here today to talk a little bit about a project that we have at PAI called the Reproductive Health Advocacy Partnership, or as we tend to refer to it, RAP. So with generous support from the Hewlett Foundation, RAP supports civil society organizations in Malawi and Zambia to strengthen their organizational and advocacy capacity. And we've been working since 2016 with 5 partners, 2 in Malawi and 3 in Zambia, to really develop locally driven strategies. And one of the things, or there's several things that I really love about this project, I think are a little unique to maybe sometimes how these type of partnership approaches work. So the first I wanted to talk a little bit about was way back in 2016 when the project started, we decided to send out a request for proposals to organizations, but rather have them send in really specific project ideas. We asked for more of an organizational profile. And once we decided that the organization sort of met the ideas of RAP, we provided 6 months of funding, which was only a short amount of time, but that was really for partners to do landscape assessments, build their strategies, have key stakeholder interviews, to really develop that strategy, develop like what would typically be in a proposal, but we didn't want partners to feel rushed and we wanted them to have funding to do that work. So for 6 months, they did that. We worked together. PAI provided support throughout that process. And then we brought all partners together to do a SMART advocacy strategy development training that AFP has developed. And it was a really great opportunity for all partners to come together to really learn from each other. We had very different levels of advocacy expertise in the room. So those that were working with service delivery organizations who are really, like, they were just breaking into advocacy. SMART, this meeting was a great opportunity to learn how advocacy fit into their broader organizational mission. We had seasoned advocates who are really using SMART to develop clear advocacy strategies. So after that, PAI provided an additional 4 years of support for partners to implement their strategies. And over the course of those 4 years, we really worked hard to create a deep partnership between PAI and the partners in Malawi and Zambia, but also among the partners themselves. So we had several meetings and workshops, we had one-on-one conversations, we elevated the work of partners at domestic and international meetings, and then we convened partners on specific issue areas that they had identified. So an example that always sticks in my mind is we had one partner who really wanted to start engaging with faith and traditional leaders, but they hadn't done that. We had another partner who's been doing that for years. So we helped to bring those two together. They shared their expertise, and I think everyone walked away with more knowledge, but also a deeper understanding and partnership and trust and being able to reach out to the other partners on their own. And so last year, thankfully, thanks to the Hewlett Foundation, we were awarded another 5-year grant, and we could decided to continue with all of our existing partners. And this time we gave them 4.5 years of funding. So I think that really helped to know that we knew we were in this together for at least 4.5 years, another 4.5 years. So it allowed them to, we didn't have to work on like a 1-year project and have to think about resubmitting for another proposal. So knowing that we could just work together and learn together and grow together really helped to deepen that partnership. And I will just say one other thing, because I guess I'm probably getting close to my time, is that we also wanted to make sure the support that we were providing to partners was really flexible and reflected what they needed. So we had a conversation about, did partners want general operating support funding with really, very little guidance, very little, parameters, or did they want that sort of more specific advocacy funding like they had received in the previous 4 years? And we went back and forth. We had a lot of conversations as a partnership about that. And we kind of decided on what we're calling general advocacy support. So it's, there's no caps on indirect costs or salary costs. It's still really flexible and really open, and partners have the ability to make changes as they need. But they wanted that money earmarked for advocacy, because sometimes that can get lost in just like big general operating support grants. So it's sort of a combination of both the general operating support and advocacy. And we've been doing it now for only about 6 months, but it seems to be working pretty well. And all partners have decided to build on the success that they've had over the previous 4 years and continue to build on those advocacy successes. And I think that just really shows when you commit, when you have these commitments for long periods of time, when you have this flexible funding, we can really build and we can make these changes. So I'll stop there. I don't know if Natasha, I can pass it over to you, or if Katrina, you're gonna jump in, but yeah, it's just a really exciting project, and happy to talk more about it over the next hour or so. So thanks.
Thanks a lot, Ellie, and we will come back to you for more detailed question, but now I'm very thrilled to hear from Natasha from the other perspective. How is it for the implementing partner to be part of this collaboration? Over to you, Natasha.
Thank you so much. Good afternoon, good evening, good morning, everyone. Mulishani won't say, how are you? That's just a greeting in my local language. It's been a great partnership. I'll be very honest. Some of the keywords that Ali used were words that I had written down, and it's not that we had rehearsed this or something, but one of the most helpful aspects of this collaboration has been flexibility. Often donors think that when they are flexible, the implementers will use that money just to pay rent and things like that. But what we've observed is that with the flexibility and co-creation that has come with partnerships like the ones we have with PAI, we are inclined to do more advocacy work, because we also understand that advocacy funding pool is very small. So instead of using this money for a lot of other things, we're then using it to do more advocacy work. And what has been helpful as well is co-creation and flexibility, is not just in terms of how the money is used, but it is also in terms of, if we decide that we're going to work on value clarification this month and the political landscape changes, can we do something completely different? Now, that flexibility is very important for advocacy because the political landscape changes quite fast and quite frequently as well. What has also worked very well is when we join government structures. What is effective in advocacy is working with government, not in a sense of an opposition party per se, but just to provide accountability and checks and balances, and also to join government efforts in meeting some of the objectives. So for example, we are part of the family planning technical working groups, adolescent health technical working groups, and other structures, which then allow us to contribute to government processes. There was a question that was asked a couple of days ago in terms of how do you sustain advocacy capacity by one of our donors? And one of the ways we do that at Copper Rose is we hire young people, because young people are passionate. And when we are hiring young people, working with young people, we're not just looking at it in terms of being a recipient, but we look at it in terms of working with young professionals. Another thing we do is that we think of large organizations as allies and not as enemies, because often in the youth programming space, there's this separation between what they call adult organizations. Even though we're all adults, I find that very confusing. But there's this idea that big organizations just want to swallow small organizations. But what we've seen is that big organizations have been lifting us as we go along. And now we are even partnering on bigger projects like bilateral agreements and things like that, bringing a youth voice to such spaces. So even as we advocate towards government, we also do our advocacy in the sector, within the sector, to ensure that youth voices are on some of the biggest multi-million-dollar projects, so that those lenses of a young person are brought to such high-level discussions. And lastly, I'd like to talk about what kind of interventions work. Like I mentioned, flexible interventions work. Flexibility from the part of the donors, even the partners, is very effective. Even collaboration amongst groups instead of competing has been very effective. For example, some of the areas where we work, we've been able to see that because we have actual implementation activities outside advocacy, our advocacy efforts have been more fruitful. So sometimes people think of just funding groups that challenge government, but what about helping government? What about providing some services? Because in some of the areas we provide demand creation activities, which is in, for example, in Mazabuka district where we're working in southern Zambia. Because we were doing demand creation activities and outreach activities, which ideally the government is supposed to do, they then got to see that there is need for abortion services in that area, and then what they then did is put some healthcare providers and put all the facilities that are needed to provide those services. And what that means is that sometimes the true advocacy is in service provision. So when we have donors that are accepting of these kinds of changes, then it makes it easier for us to do our work. And lastly, one of the most effective interventions has been multi-year funding. With multi-year funding, it's easy for you to change direction from one angle of the same challenge to another, but it also gives institutional memory, because one thing we need to understand is that there's also the people side of the advocacy function. In organizations, if you give someone a one-year contract, they are more likely to leave or join some other organization where they'll get a 3 or 4 year contract. So from the human side of things, in terms of management side of things, it's easier when we have multi-year funding, because we can then give multi-year contracts to our staff. And that helps us to prevent some of the attrition that is usually seen in advocacy work. Thank you so much.
That was really on the point, 5 minutes, fantastic. I was wondering if the audience could use the reaction button to give a round of applause to Ellie and Natasha, to thank them for breaking the ice at the conference. While we move on to the second example, which is a collaboration between AFP and PPD. And I'm very happy to welcome Beth Frederick, who's the co-principal investigator and executive director at Advanced Family Planning. Beth is a long-standing advocate dedicated to ensuring sexual and reproductive rights and health for all. Welcome, Beth. And Beth is joined by Eva Nakimuli, who's a program officer at the Africa Regional Office of Partners for Population and Development. Eva is also a seasoned SRHR advocate. She has built strong partnerships with the civil society fraternity, plus relevant ministries, departments, and agencies in a bid to create a favorable policy environment and to mobilize local resources for FP. So, Beth, I would like to hand over for you. You also have 5 minutes to talk about your approach to strengthening capacities for advocacy. I see that you are speaking. I think you're still on mute. Let's see if we find the bottom. If not, we could also...
Here I am.
Here we go. Perfect.
Yes, thank you. Okay, it's hard for me to believe that in a few months, the Advanced Family Planning Initiative will be 12 years old. Sustained advocacy and advocacy capacity is something to celebrate, and I'm glad to have Eva here to join me in celebrating. She wasn't exactly prepared to do remarks as Natasha did, but I'm sure she can chime in at the end with a few reflections of her own. When we started working in Africa and Asia, capacity wasn't an issue. We were testing an advocacy methodology that coalitions could use to persuade a decision maker to act within a 6 to 12 month time frame. We worked with people in established organizations who were frustrated by policy and funding barriers to contraceptive access and ready to try something new. As we grew, we diffused our smart advocacy approach to a wider network, and the smart approach served us well, even in strengthening our collective capacity. It forced us to focus on those capacities that were also smart, specific, measurable, attainable, relevant, and easy to diffuse quickly. Even though we're here to discuss capacity building, I hope we can all focus instead on shared strengths. Every person, from those new to advocacy to the old pros, come with their own capacity, knowledge, and experience. And that was one core effort on the part of AFP to recognize those attributes. But the trick is to use it wisely and collectively. And so Advanced Family Planning focused on 7 guiding principles that we live by to this day, and all relate to think about how we leverage and strengthen advocacy capacity. We first committed to being locally driven. Local champions would determine priorities and direct activities. We wouldn't do it in Baltimore or in the United States. And that included identifying their own needs for new skills and better tools. Second, we focused on the policy and funding decisions that were easiest to attain and that had the greatest potential. Initially, we worked side by side with local advocates to gain consensus and a clear focus. But after 1 or 2 smart sessions, most were able to operate independently. Third, we relied on evidence to set and support local priorities. We first used existing data in each context. Here, though, it helped to have an advanced family planning in the Johns Hopkins Bloomberg School of Public Health. In the school, we had a worldwide network of researchers and practitioners at our disposal to put a foundation under advocacy and reinforce that local knowledge. With principles 4 and 5, we pledged to be collaborative and influential. From the outset, we built systems for open and inclusive communication, most importantly within and between countries, but also within global networks such as FP 2030 and the Reproductive Health Supplies Coalition. The 6th and 7th principles, they focused on being accountable and sustainable. These may be the areas where capacity was needed the most for everyone, for all of us. Advocacy has suffered from not being seen as having impact. Strong performance monitoring, evaluation, and learning frameworks help track progress and increases in access to family planning and connect advocacy to impact. But they're often intimidating, labor-intensive. In response, we created methods and tools for documenting the outcomes and reach of advocacy wins that can be easily adapted, learned, and used. In practice, all of AFP's principles and our evolution were part of meeting the capacity needs identified by our network. Our central approach, the thing that's made us successful, remains our focus on learning by doing. And as smart advocacy took hold, we focused on testing whether it could be used for other health and development issues, not just family planning. The first smart advocates trained others in the approach. This is how we're doing capacity building, exponentially increasing capacity. And as we gained momentum in achieving national and subnational budget allocations, often in partnership with PAI, we worked to strengthen our ability to see whether and how those funds were spent. In focusing on sustainability, we work to reinforce advocacy as a strategic priority within international NGOs. And now we're reinventing the smart advocacy approach to integrate more than a decade of use and the results, and to apply it to many more issues. At all levels, AFP played a convening and connecting role, evolving that role as new issues arose. We hope that will continue after our project ends. I leave you with one thought. None of us will ever have all the capacity we need to deal with everything that comes our way. COVID-19 is a great example of that. So let's start shifting to a lifelong approach of learning from one another. Only through that shared strength will we sustain advocacy and succeed. And one of our most successful partners is Partners in Population and Development and Africa. And I'd love if Eva has a short comment after this.
Thanks a million, Beth. There is a great team working here behind the scenes, and they let me know that, Eva, you will come in later at a later point in the session. So I would now like to move over to my great and dear colleague, Peter Owaga, our country director in Tanzania. Peter will talk about the SLALE project, which has already been mentioned earlier in the conference. And Peter is a development professional with more than 15 years of experience. He's responsible for the overall leadership and strategic direction of DSW's activities in Tanzania. And he's also supporting very much the team that is working on the SLALE project. Peter is today joined by Benjamin Katana, who's the CEO of Safe Community Youth Initiative in Kilifi in Kenya. And Benjamin is a passionate SRHR advocate engaged in building capacities of young people to effectively advocate for gender equality and SRHR in coastal Kenya. So Peter, over to you. Tell us a bit more about the SLALE project. 5 minutes, please.
Thank you very much, Eva and Katrine. I just wish to share quickly what we've been doing as DSW globally, but also in the specific program of SLALE. Firstly, I just want to appreciate the efforts that have been done by the partners and all colleagues in the project thus far. So as we all know in advocacy, it makes us stronger to work together. And we are proud to have had the coalition within these 4 years of implementation in Tanzania, Kenya, and with great support from our colleagues at head office. So in DSW, we've been doing capacity strengthening of CSOs, but also we've been working very closely with other colleagues who've been doing advocacy, meaning development partners that target decisions specifically on youth and reproductive health issues. And in DSW, the approach we used, first of all, one of the key steps that we have is engagement, or building trust with the partner before you proceed with the capacity strengthening. And we do this, first of all, to get buy-in, but also collaboration within the individual staff working in the organization itself as a whole, meaning the board and also the other constituents. But finally, within building the trust and the engagement, we also engage the government, because we understand that for you to do advocacy and bring change, you need to have the whole ecosystem working together. So first of all, in the engagement, we did the contracting and also the assessment of the partners, but also to have their trust in terms of what specifically can we do together in the area of RH and FP. But within that approach of assessment, it was very participatory, meaning that there were self-administered questions, there were discussions, there was dialogues, there was engagement of consultants who are neutral. But also importantly is that we had sessions that are prioritized by all the partners who are working together in this coalition. So we had priorities of what really needs to be done so that we can strengthen capacity in advocacy. And we had centralized trainings in advocacy work. And then after the training, we also had tailored mentoring sessions for specific partners on advocacy work, but also we had the issue of, accompanying the partner on site when they were doing the actual advocacy. And after that stage, we had the opportunity also to do sub-granting with the partners, so that whatever capacities they've had in advocacy work, they can try it out within the implementation phase of the project in terms of developing strategies for specific advocacy issues that they had, but also trying to have a plan on how the tactics they've learned, the decision makers they're targeting, how best they can package their message and bring about change. And it's been very impressive that all partners tailored their advocacy asks or the projects based on the actual issues on the ground within the geographical areas they are working. So it was very impressive to see change at the third level, meaning the constituents, because different partners design different projects that they could handle within where they are geographically. The other approach that we use in DSW in all projects that concern capacity strengthening is to see organizational development per se. So apart from just doing advocacy, we looked at the whole spectrum of organizational development issues, governance and leadership, monitoring evaluation, programming for youth, organizational network assessments, and resource mobilization, among a few. And why do we do organizational development capacity strengthening also, apart from just advocacy capacity strengthening? Because advocacy work also needs an organization that can be effective and efficient in what it's doing, so that whoever is doing the advocacy work has the confidence, but also the trust also of the decision makers that their own organization is up and running in a stable way, so that they can also have the right messaging to the decision makers. And this is because if we say in advocacy work, you need also to walk the talk. So if we're talking about accountability issues, it means also the leadership, the governance issues within the organization itself has to be good. And then it's also important to share the fact that while we are doing our trainings, they were tailored according to the needs. So the timing of the training depended on the organization itself, but we also looked at the other element of finance management because we are giving grants. So we had the pre-award assessments, but we also had financial management health checks so that we can support the partners and also learn from them on how best they can do their projects in a very participatory way. And we appreciate that throughout the phase of the projects, the systems within the organizations were strengthened on top of the advocacy skill sets that they also gained during the collaboration. Finally, it's also good to appreciate the network that was built during the course of the project, because as it was said earlier on, we can only make good change if we work together. So most partners had technical working group meetings, but they also worked together to share lessons learned, strengthen their capacities, but also have one voice within the issue that we had in Tanzania. And that said, I really want to again to thank the partners in Kenya and Tanzania for bringing change in most of the work that they were doing in terms of the grants they were given, but also the good collaboration that seems to be there right now amongst the partners across the board, with also the working closely with the governments that are in the two countries that we work together. And also, finally, it's also important to note that the consultants that supported the process, it wasn't only the staff in DSW Tanzania who were doing this and Kenya, but we also had support institutions like ASPEN, some of the colleagues from head office and also from East Africa who really supported the process thus far. So we really appreciate the support from Hewlett, but also overall the change that the partners have made so far in addressing the issues in advocacy work that you are targeting. Thank you very much.
And I'm super curious to hear from Benjamin from Kenya, how your experience has been in this SLALA project that we are all very fond of at DSW. Benjamin, over to you.
Well, thank you very much. Good morning, good afternoon, good evening. My name is Benjamin. I work for Safe Community. Safe Community is a for-impact organization empowering adolescent young people to undertake effective advocacy, sexual reproductive health, and gender equality in the Coast Region counties. So our priorities in Kilifi, Mombasa, and Kwale counties are one, to advocate for the influence in policy change and also prioritization of youth sexual reproductive health programming by the county governments. We also do capacity building for young people and also provide services. This includes family planning services for adolescents and young people to reduce teenage pregnancies, HIV counseling testing services. We also do youth empowerment on livelihood to improve youth employability. So under the SLALA project, we've actually benefited so much from this collaboration. We're looking at three objectives: one on media, leveraging on media to advocate for youth-friendly centers in Kilifi. Then we're also looking at how we can actually increase our partnership to advocate for youth-friendly centers, and also leverage on the advocacy moments to advocate for youth-friendly centers. It is very true that partnership or collaboration takes full advantage of the resources, knowledge, skills, expertise for greater impact than working alone. Through our partnership with the SLALA allies, we had DIO, we had PYN, whom we've actually worked with in this project. At some point, each organization was looking at each objective. One was looking at how we can actually develop advocacy messages, both in English and also local languages, targeting the power holders. Then the other ally, that is PYN, was also taking lead in the organizations through the online platforms to amplify youth voices towards establishment of the youth-friendly centers. So through the capacity development program that we've gone through, we've actually increased knowledge and skills in terms of developing advocacy tools, which are very, very vital, especially when it comes to influencing the policymakers. We've also looked at how we can actually do power mapping, identifying the power holders, influencers, and decision makers who can actually influence our advocacy ask, and also understanding the budget cycle. So through our collaboration with DSW and the SLALA allies, we've been able to actually advocate for the youth-friendly centers in Kilifi. And through our advocacy efforts with the SLALA allies and DSW, we have 4 youth-friendly centers which were established. An allocation of $72,000 were allocated by the county government in the financial year 2018-2019 for the equipment or equipping of these youth-friendly centers. Another $26,000 was also allocated for 2019-2020 financial year for the equipment of these same youth-friendly centers. And through our advocacy efforts with our partners and our allies, we've actually influenced the Department of Gender, which committed to convert all the social halls in the community, in the Kilifi County, that is, into community innovative hubs. which will actually integrate the access to sexual reproductive health services and information for young people. And the county government has allocated $90,000 US dollars for the financial year 2020-2021 for equipping of these youth-friendly innovative hub or community innovative hubs. So being a youth organization in Kilifi and also a partner in Kilifi, we've been able to reach different partners and different policymakers and decision makers through the allies and also DSW and other partners. And through our coordination and collaboration, we've also managed to mobilize young people in the county to amplify youth voices on the establishment of the youth-friendly centers. We also managed to mobilize policymakers, influencers, and the media. Media is a very powerful tool, and that is why we've been using the media, especially through the Twitter storms and also radio talks, to raise our voices as young people in Kilifi County. And through this, we've had different results in the county. So the capacity development program is a very well program that has actually built our capacity to undertake effective advocacy on sexual reproductive health and family planning matters. Thank you very much.
Thank you so much, Benjamin, for sharing those insights from your work in Kenya. I promised in the beginning that we would also bring the donor perspective to this panel, and I'm now very pleased to welcome Althea Anderson, who is a program officer at the William and Flora Hewlett Foundation, a foundation that has already been mentioned several times in the interventions. Althea is focusing on gender equity and governance, and she's responsible for grants to support research, advocacy, and programming that aims at expanding women's reproductive choices, economic opportunities, and social well-being. A warm welcome to you, Althea. And what I would like to ask you is that the Hewlett Foundation is supporting many initiatives aiming at strengthening local advocacy. Could you elaborate a little bit of the strategy that you have in doing so?
Many thanks, Angela, Katrine, and Sabine, for inviting me to join this conversation. It's been very inspiring to hear from colleagues throughout this session. So, as Katrina said, I'm Althea Anderson. I'm a program officer in the William and Flora Hewlett Foundation's Gender Equity and Governance program. I oversee grant making in our global reproductive equity and women's economic empowerment strategies. And today I will share some of my reflections on funding SRHR advocacy in Africa through the types of partnerships many of you participate in. So to give some context, in the Foundation's SRHR local advocacy portfolio, there have been about 10 grantee partners, including DSW, Advanced Family Planning, and PAI, that serve as re-granting and capacity building intermediaries to over 100 African civil society organizations, or CSOs. In the beginning, 5 years ago, our focus was that African CSOs should set priorities for their SRHR advocacy. International NGOs, INGO, grantee partners should offer sustained technical assistance and long-term funding partnership to African CSOs in ways that reflect mutual accountability. So there have been many lessons over the past 5 years of this work, and I'll share a few highlights related to partnerships built on trust, equity, and mutual accountability. So shifting advocacy priority setting to African CSOs was relatively easy. It was an easy shift, as my colleagues have shared in this session, but mutual accountability was very hard for everyone to understand. So collectively, we kept asking questions. In my visits with African CSOs over several years, I've asked, how is mutual accountability reflected in your partnership with this particular INGO? A common answer was, mutual accountability is good. I submit my progress reports on time. And I would ask, how is your INGO partner accountable to you? Honestly, many African CSOs couldn't grasp that this was even possible. Speaking openly about what these known power dynamics in funding and decision-making was unthinkable. So Hewlett brought African CSOs, INGOs, and the foundation together in large convenings. As the foundation, we brought up the topic of mutual accountability as it relates to decision-making about capacity building priorities, subaward agreements, and budget transparency. What became very clear is that there are multiple layers of power inequities between funders like Hewlett and grantee partners, and between grantees who serve as intermediaries and sub-grantee partners. So over the last few years, we've been asking ourselves, what do we do with this awareness? How do we work in more equitable, trust-based, and transparent ways? The Foundation and our partners have applied a critical lens to our partnership models and practices, as you've heard from some of my colleagues today. And the Foundation has evolved our grant making and partnership approach to ask different questions. For example, how do we see SRHR policy and funding advancing in the Global South? And what is the role of funding and capacity strengthening intermediaries in this work? What are our assumptions about SRHR advocacy capacity building and about funding flows? For those closest to the work, how do we increase access to private philanthropy so that there's transparency about what is needed to advance SRHR policy and resourcing at the national and subnational level? And how are these local needs aligned with and guiding funding priorities? What are our capacity strengthening graduation intentions and intermediary grant making relationships? When is a sub-awardee ready to graduate out of a capacity building relationship to receive general operating support from partners or direct funding from private philanthropy? And what are our accountability mechanisms for how we meet our equity intentions? These mechanisms need to be developed in partnership with those closest to the SRHR issues. What are the indicators of progress for funders in advancing mutual accountability and equitable partnerships? Who is assessing our progress? And how transparent are we about our failures and mistakes? These are the important questions in our field, with no easy answers, but we must find practical ways to address these power dynamics and think and work in more equitable ways. And I welcome your questions and reflections about Hewlett's evolving strategy. Thank you.
Yeah. And thanks to everyone for this really inspiring and interesting first round of intervention. I would now like to dig a little bit deeper into it, and I would like to hear from all of the three projects. In your experience with advocacy capacity development, is there any specific challenge that you have encountered which was not easily resolved? It's not so easy to talk about challenges that are not easily resolved, but I think it could be very interesting to hear from the three projects in a short intervention, about 2 minutes each, what these challenges were, how you addressed them, and what you also would like others to learn from your experiences, what you would like to share. So I would suggest that we start with Ellie from PAI, followed by Beth from AFP, and then Peter from DSW. Ellie, over to you.
Thanks, Katrine. I'm actually going to ask Natasha, I think, to answer a little bit of this first. We talked in advance, so we kind of tag teamed on this one. So she's going to start and I'll jump in next.
And Ava's going to take my place. So.
Thanks, Ali. So one of the things that has been difficult to resolve is the sense of responsibility. It's often very difficult to determine whose responsibility it is to act on some of the advocacy needs we may have. And this may not just be from cannot just be from the perspective of the people that are working on the project, but even when you go on the ground, oftentimes it's very difficult when we do our smart advocacy training to know whose responsibility it is to act on those objectives that have been set. Ali?
Thanks, Nat. Yeah, so I think, sort of similarly from my perspective, thinking about whose responsibility it is for advocacy, but more from the organizational side of things. And so as Nat and I were talking about how we wanted to respond to this question, I was reminded of a time when we did a workshop and someone came from, one of the partners who was there brought someone from their fundraising team. And the workshop was really all about advocacy and like developing your advocacy strategy. And I remember very clearly she started, she's like, oh, I'm just here to listen. And by the end of day 3, she's like, I get it. I get how advocacy is important to our work. I can fundraise for this now. And so thinking about, who to engage is, it's everyone. There's so many people, and not everyone has to be the expert in terms of implementing, but bringing in different folks to understand the importance of it, I think is something that we continue is a challenge that we continue to try to face and expand who is for part of this partnership.
Thanks a lot, Ali. Eva, does this sound familiar to you, or is there a different challenge that you have encountered that you would like to share? I'm not sure. Eva, are you with us? Okay, then
Yeah.
Yeah? Brilliant. Hello. Please go ahead.
Hello, yes, I am. Thank you. Good morning, good evening, good afternoon, everyone. It's wrong to focus on one specific challenge. Advocacy is only effective if it adapts, and that includes adapting to challenges. So in my opinion, developing strong advocacy capacity relies on building blocks that build on everyone's knowledge and perspective. I'll cite my example of the first encounter we had with AFP Smart Advocacy. It was during a short session with Beth, where she asked 3 of us to develop personal SMART objectives. Mine was to start a garden of my own so that I can get food from my own garden. And in this, I learned that I had a decision maker, and I had to find the right messages to have this advocacy ask granted. So I wasn't sure I was learning advocacy or that it would work, but 5 years later, I have been able to achieve this, having realized that my decision maker at that point in time was my spouse. So very soon after that first training, I was asked to help another organization develop an advocacy strategy, and they did it very well, but there was a challenge. They were accustomed to reporting milestones as results, and yet smart advocacy only counts wins when a policy or funding decision is made. This was an important shift in thinking, and we had to reorient these organizations to make them appreciate that where there are milestones, which are great, we still need to report on quick wins upon achieving the SMART objectives. So that helped create a shift in the understanding of the organizations and our advocates. So within Uganda, Advanced Family Planning, through Partners in Population and Development Africa Region Office, together with Reproductive Health Uganda, we have diffused smart advocacy to over 30 organizations and countless individuals. But a key challenge is that these individuals usually leave the organizations when they take new jobs or are appointed in different posts. And we have tried to overcome this by remaining connected, continuing to support their needs for advocacy advice, even in other health and development areas, and wait for their return to our issues. And this has seemed to pay off as we always keep in touch. The other challenge that I see is that some partners still mistake activism for advocacy. So one long-standing challenge is attribution, where there's a challenge in who gets credit for an advocacy win. It's an issue because usually funders want to know that their support is going directly to changing the issue that they care about. So typically every organization says that they were the ones that made the change happen. But successful advocacy depends on collaboration and partnership building and sharing knowledge and resources. Partners ought not to compete when they are pursuing the same objective, but rather leverage resources. From the very beginning, Advanced Family Planning and we as their partners in Uganda took a different approach. With the okay from our funders, we encouraged everyone involved in the advocacy effort that we were taking part of to take credit for their contributions. And most importantly, that included the decision makers who worked in partnership with us. Previously, there was fatigue among the decision makers, with each partner individually engaging them over the same issue. So this approach has had dramatic results. It has made it easier to work together again, and it puts the decision makers in the spotlight, and it has helped to hold them accountable.
Thank you so much, Eva, for sharing these experiences and challenges. Sound very familiar to me also from our German advocacy work. And Peter and Benjamin, does this resonate with you as well, or which challenges have you been encountering? Peter, maybe you want to go first.
Sure. Thank you. I think from what the other colleagues have shared, there are some areas that also happen to have been encountered by partners in Tanzania and Kenya. But the challenge that I saw during the capacity strengthening initiative is that from the supplier point of view, meaning DSW, to the partners, different partners are different stages of growth. So there were nascent organizations, there are mature organizations, and here we are having a project that has a timeline. So I think it was not easy during the first instances to design a training module that fits all. It can't be a one size fits all. But also the other challenge was that despite the strategies that were there, with some partners doing it for the first time, they were not really impressed that they're not getting results. So advocacy is a process and it takes time. It's not an event. So it's good also to encourage the partner to move on, change tactics and stuff like that. So we managed to do this by working together, sharing lessons amongst the partner networks and allies. But also the other challenge that is there and was there in the past 2 years of the project, as we all know, is COVID-19. Most of the decision makers would like within our setup to be approached personally in the office. So it was not very usual to have maybe a phone call to talk to a decision maker. And this took time to adjust. But yes, we supported our partners and they also supported us also on how best to engage with other players through influential people within the network without necessarily having physical meetings. So I think this was done through supporting partners with the facilities and the resources, but also engaging the other side of the project, meaning the decision makers, to know how best to engage with them through Zoom and other virtual setups. Thank you.
Yeah, I think adapting to new ways of working under COVID is also a very familiar experience that we've gone through over the last 1.5 years. I would like to come back to a point that Eva already touched upon. When you, Benjamin and Natasha, also looking back to you again, when you work together with other local organizations that do not have the kind of support that you have through the projects that you have described with PAI and DSW and AFP. How is it for you to work with these other partners? Have you experienced challenges in that cooperation and how have you gone about them? Maybe Natasha, if you want to start?
Thanks. One of the biggest challenges when it comes to joint advocacy is that in our setting in Zambia, for example, when the youth movement or any kind of movement becomes big, it becomes prone to political interference because often advocacy leaders would make better leaders for parliament or things like that. So one of our biggest challenges is political interference because either the ruling party or the opposition parties start to work with those groups, and once they become tainted as political, then even if they're talking about the lack of condoms, it's seen as a political move, and that's one of the biggest challenges we have. Another challenge we have is competing for resources, because in as much as we may have joint advocacy efforts, we may not have the same coverage for funding, and that becomes usually a cause for a lot of differences amongst the different partners. One way that we've tried to get past these challenges is making it very clear what the goals and the objectives are. And anytime we identify any conflict, we ask people to step down or step up. Yeah.
Thank you. The line was a bit shaky in the end, but I think we got the main points from your intervention. Thank you so much for that. And Benjamin, over to you. How is it for you to work together with other organizations that are not part of the SLALA project?
Yes, so one of the challenges that we've experienced is knowledge gap. We understand that what we understand or what we know is not what other organizations know. So we've had that challenge, especially in the development of advocacy tools. Some other local organizations were not knowledgeable with the development of other advocacy tools. Most of the organizations were not knowledgeable on development of memos only. So through our support, through our knowledge and the capacity that we garnered from the training, we managed to actually develop fact sheets, policy briefs for quick wins. And out of our knowledge and also partnership, we've been able to actually see so many results, especially in the commitments by the policymakers and also resource allocation towards establishment of youth-friendly centers. Then about the issues of understanding the key advocacy moments and the budget cycle, I think this is one of the gaps that most of our local organizations do not understand about this process. Most of these organizations were coming very late when some of these processes had already been developed. For instance, the annual development plan, the annual work plan, the county fiscal strategy papers. So most of the organizations do not understand about this cycle. And then the other thing related to knowledge gap is on power mapping. We have different decision makers, power holders, influencers, partners who are very vital in advocacy processes. So we realize that most of our partners, local partners that we're working with, may not have that vast knowledge in analyzing or identifying all the policymakers or influencers and decision makers who have that power to influence our advocacy issues. Thank you.
For questions from participants, so please remember to type your questions in the chat if you haven't already. But before coming to those questions, I would like to hear a bit more from the donor's perspective from you, Althea. And you already touched about the point of power dynamics that are obviously present in these kinds of constellation. And it's a very crucial point for the Hewlett Foundation and your work as well. So if you could maybe tell us a bit more about what you as a donor can do, or also other donors can do to overcome these challenges around power dynamics, and especially also in these partnerships to strengthen local advocacy capacities.
Yes, thanks for the question. I feel like as a funder, we hold a lot of power to contribute to addressing these challenges that have been brought up. And we have a responsibility to shift decision-making power to develop solutions to those closest to the issues. But change really starts with ourselves as a funder. First, it's acknowledging our historical and present-day contributions to fostering inequities in the SRHR field. Then we must unlearn and reorient our thinking, integrating more equitable and inclusive practices in our grant making, beyond the grant dollars work and our philanthropic advocacy with other funders. And I think of this as an iterative process that's not kind of linear. So the more we know, the more we need to rethink and show up better as funders. And the difficult work is the stages before the doing better. It's acknowledging, unlearning, and reorienting. I think it's very difficult to be better without thinking differently first. So beyond asking different questions, funders need to expand the network of people that inform our decisions. Hewlett has funded in the SRHR field for over 50 years, and for the most part without country and regional offices, and until recently without hiring full-time staff from the regions in which we serve. So we've not been very close to the issues. We have funded primarily through global partners who have been our primary grantees for decades. And when we invite new concept notes, develop proposals, review reports, refresh strategies, these global actors have been the ones we continue to turn to inform our priorities and funding decisions. So through our new refreshed global reproductive equity strategy, we decided to evolve our approach based on acknowledging, unlearning, and reorienting our thinking and grant-making practices. The evaluation of our local advocacy portfolio was a main contributor to our evolved grant-making approach and the launch of our new strategy just this past Tuesday. And if you'd like to learn more about this strategy, I am sharing a link in the chat. And I'll stop there.
Thank you very much. Thank you very much, Althea. Thank you very much to all of you discussing in the panel so many very important and very enlightening topics. Thank you, Katrin. And now I see it very small here that we have a lot of comments and questions into the chat, which are to be collected by Sabine and Connie. And well, there we have the first question, and which is directed to Beth, Peter, and Alison. And I read it out loud to you. I see it the first time myself. So we have heard a bit about the importance of mutual accountability and power dynamics. What are your approaches to overcome power dynamics in your partnerships? So.
Well, I'd like to start by actually taking Althea's advice and giving my spot to Eva, not to Muli. And not giving, she already has it. Eva?
Thank you, Beth. Okay, power dynamics are facts of life, and no leader is happy having their toes stepped on in advocacy. So usually in advocacy, we make that mistake, but we need to turn them from targets to partners as decision makers, so that they are really a part of the journey that we want them to walk. And so we need to develop their capacity to see policy and finding decisions as well as this change in this world. So with that recognition, the decision makers really feel that they're part of this advocacy journey. And so we really need to respect the power dynamics. Over to you, Beth.
I just want to make one extra point, which is that I think we need to stop opening space for others and have hard discussions around the systems that impede our ability to advocate. And advocate together for the rights, health, and well-being of all people. Those power dynamics are embedded in everything we learn from our first school days through our first work experience. So it's going to be hard to take the unlearning agenda seriously, but I think we've got a good opening for it now.
I lost you for a second, but
Okay.
I'm happy to share. Or Peter, do you want to go ahead?
Okay, just go ahead. No problem.
Okay. So yeah, I think, listening to what Althea was saying earlier, I think it's really hard. It's sort of acknowledging that addressing power dynamics can be challenging, but it's incredibly important. And so, I think the opportunities that the Hewlett Foundation has provided as part of this work, bringing all partners together across from Hewlett to the PAI, DSW, AFP, to all of our partners, has really created some of those opportunities to have those conversations that need to happen. I still remember being in Kenya, I think one of the first meetings where we had an opportunity to sit with some partners and talk about what some principles would be to address mutual accountability, to try to achieve transparency. How do we work together to address these power dynamics in this project? Because it's something that we all believe is important across this bigger project that the Hewlett Foundation is funding. And so we've really taken that to heart. We implemented them as part of RAP and have incorporated them into our work. And of course, I think there's always opportunities for revision and reflection. But I do also, I think I always talk about the long-term flexible funding aspect is just being, I'm kind of a broken record on that, but I think it's so important. One of our RAP partners we had been working with for many, many years. And so for him, he would say, like, if I can't get Allie on the phone, I'll get her colleague on the phone, or I know the CEO, or, whereas some partners were new and they didn't have that relationship yet. So, I think it's a really good goal to have, but it's not something that can happen like that, right? You have to build that trust. And to do that, you have to work together for a long time and really show that, like, as a funder, you believe in this and you really do value it. And so I think just kind of working away at it, creating opportunities to really bring everyone together is just invaluable to getting closer to achieving it. Because I mean, it's never going to go away, right? But so trying to address it and do everything you can to lessen the negative impact of it.
Much so it's about relationship and well, perhaps even respect. Now I have a next question, might be answered by Alison or Natasha, or both of them. And so one participant wants to know, how do we build back after COVID-19? That was a topic already. How do we build back after COVID-19? Are there any lessons learned regarding organizational resilience in the advent of COVID-19? So what had some influence? So who likes to be first, Alison or Natasha?
Nat, do you want to go? I feel like I've been talking a lot.
I was hoping you would go first. Well, I would say COVID has brought a lot of opportunities and a lot of challenges with it. One of the opportunities that has come with COVID is people have realized that we need local solutions, locally driven solutions. I know this may sound a bit weird, especially looking at some of the discussions that we've been having about decolonizing global health, but I'll give you an example. Most of the money that was supposed to be spent on conferences and traveling has been given to organizations to actually use to implement activities. And as corporates, we have seen that with our existing donors. We've received a lot more funding for actual on-the-ground work, which we could have used to go to all these fancy conferences. That's one opportunity that has come with the pandemic. But many organizations haven't been lucky, especially those who were hoping for new calls for proposals and things like that, because what we've seen is that there are fewer organizations looking for new partners. Most organizations are just working with the already existing partners. So at a time like this one, one of the solutions is collaborating and doing one-on-ones, reaching out directly as opposed to waiting for calls and waiting for new opportunities, because of all the uncertainty, there's not so much going out, and it's not really a good or a fair playing field. That's one thing we've observed. So those are some of the approaches we've used. We've been pushing the envelope with our existing partners, but we've also been reaching out to local partners because we need our own locally driven solutions. In terms of programming, one thing to look at would be to also take some interest in understanding the projections in terms of the waves, because what we've been able to do is, for example, right now, we've been told by the Ministry of Health that the next wave is in December. So we've maximized on as many activities as possible between now and then, so that when the next wave comes, we will have at least a lot to show for. So as far as programming is concerned, it's quite frustrating to slow down on activities. But if you understand the trends and the projections and all the health information that is out there and utilize it in programming, it makes things so much better.
So it has had some advantage, saving money, spending it somewhere else. Alison, you like to answer?
Yeah, I mean, I think, I didn't really have much to add, and then Nat said something at the end that I think was just, it sparked something in my brain, which is around this prediction of the next wave, right? Like, we've been living in this world now for a year and a half. Some of the things sort of, I feel like we've been like, oh, it's, it's rising here, it's going down here, and we feel like we've developed some strategies to address this. But I think because Nat and I have a really great working relationship, she was able to share this with me. So we're now already planning for the next 6 months. And of course, we all, I think, know that we can't, who knows what's going to happen, but if we feel like if we're hearing that there might be a spike in December, we can really strategize together around what do we do over the next 3 months to set up the organizations to be able to prepare for that, to get the work done that they need to get done or that they really think is important. Another sort of strategy that we've started using for RAP is that I'm based in the US, I'm based in Washington, DC. I can't travel to, or it'd be very challenging and not probably the safest for me to travel to Malawi and Zambia. But they're meeting together. Our partners in Zambia are on a lot of technical working groups or coalitions together. So PAI is going to support them to come together to have a strategy discussion. So it doesn't always, I don't always have to be there, right? I mean, partners know and work together. So trying to think about different ways to advance the work and still create that partnership, even I don't always have to be there in person. So
all have to be somehow pathfinders to find new ways and to canalize our strengths and our capacities. Well, we have a new question. Might be addressed to Ben or to Eva or Natasha, so you can think who likes to answer them first. If you would like to enhance your advocacy skills, do you think it is all hands-on and collaboration, or are there also studies, research you can suggest to build knowledge in this area? So how can we enhance advocacy skills?
Hello. Yes. Yeah, different ways on how you can actually advance your advocacy skills, especially in the field of sexual reproductive health, family planning, reproductive health. One, you can either do research. Very true that you can do research on how you can actually go about advocating for your issues, either in the local government or both at national and also grassroots level. One thing we need to know is that we need to actually partner with different organizations, because advocacy is not about an individual issue, it's about the voices of the people, it's about the voices of the marginalized, or the voices of those who are in need. So you need to have many voices, you need to work together with other partners and other organizations for your advocacy issue to be actually listened by the policy makers and decision makers. Thank you.
Natasha, what's your answer?
Well, I would like to give a story, not one particular answer, but when we started out, we were medical students and just generally a group of young people getting into this space. We came with passion, but we realized we needed strategy. Some of the things we did was to join these national technical spaces. They're very intimidating because there's a lot of jargon and there's a lot of political, what can I say? It's a very political atmosphere, but you get to meet other people who will see through your passion and direct you towards tangible steps. So what we've been able to do now that we've grown into the largest youth-led organization in the country has been really from learning from other people. Because for youth-led organizations, for example, people age out. So there are people that have aged out of the youth bracket and they're still working in the sector, but they would be able to give you pointers as to where to go and what to do. There are also a lot of online courses that are going on. There's the Advocacy Accelerator, as well as many other platforms that have been created by different partners, which do provide training on advocacy. But one of the best places to start is national technical spaces, because there will be a lot of people with a lot of that experience. As soon as you get past the jargon and feeling like you don't know what's going on, that should be a good place to start.
Thank you so much, Natasha. You almost introduced the second part. Thank you very much to you all. Now, we really do deserve a short break. And so we are going to listen to the Magwani Manne song, which is a very nice song about 4 gowns. So the 4 gowns young girls or young women should wear before having a child. The first gown is a school uniform, and the second gown is the higher education graduation gown. And then the third gown finally is the beautiful wedding dress, and the fourth gown is the maternity dress. And then we can talk about children. So it emphasizes on education. This song which was sent about over to YouTube and was played on the radio, was raising awareness to avoid teenage pregnancies. It was produced by the DSW partner, Dodoma Youth Development Organization. It's in Swahili, so therefore I explained a little the story, and it's going to lead to the next session where we will hear more about the stories of change, where we watch some videos. So enjoy your break.